Welcome back to Better Kansas City. In the past 20 years, obesity has doubled, and now 3 in 5 Americans are considered overweight or obese. And unfortunately, the response to diet, exercise, and lifestyle changes doesn't always work. Dr. Sigi Joseph of St. Joseph Medical Center is here to offer a solution. So, first up, let's discuss some of the health impacts to being overweight or being obese.
Obesity actually leads to a plethora of other problems like type 2 diabetes, high blood pressure, cholesterol, reflux, joint pain, sleep apnea. The problem is not only you develop those things over a period of time, that affects the blood vessels in the body, like basically a cardiovascular risk, affecting blood flow to the heart, to the brain, kidneys, so on and so forth, leading to stroke, heart attacks, so on and so forth. So those are the long-term effects of obesity. Yeah.
And you just mentioned several major organs, so it is something that we really should be watching.
Correct.
So let's talk about bariatric surgery and maybe who would be a good candidate for this.
The typical candidate would be anyone whose body mass index is more than 40. Body mass index is a way of standardizing your weight to your height. So if your BMI is more than 40, you would generally qualify for surgery, provided they have the bariatric benefits. Or if the BMI is more than 35 with 2 of the listed comorbidities that I mentioned earlier, then they would qualify for surgery.
Okay, and what exactly is bariatric surgery?
Bariatric surgery is basically any surgical procedure that changes, it restricts the amount of food that you eat, or it causes some kind of malabsorption of the food that you eat, leading to weight loss.
And what would the medical benefits of something like that be?
The long-term, the medical benefits, obviously they're going to lose some weight, and that will significantly improve the quality of life over a period of time. Imagine not having to carry another 100 or 150 pounds every day. So losing that weight, that's huge. It significantly improves your quality of life. In addition to that, medically, I think it causes significant resolution of diabetes, high blood pressure, cholesterol, sleep apnea, reduces joint pains, and eventually leading to better health. You have to take less medications over a long period of time, reduces your cardiovascular risk or a risk for a heart attack or a stroke and those kind of things.
Well, and that's huge for people. Now, let's talk about the actual surgery. What support is available for people if they choose to get it?
Now, prior to surgery, they have a 1-hour seminar they have to attend where all the information about bariatric procedure is given and what their expectations are. Then they see a dietitian on a monthly basis, go through a supervised diet plan, and then they have the surgery. Now, after surgery, they'll continue to follow up for the rest of their life. At least they are expected to follow up for the rest of their life. They'll be seen more frequently in the first year after surgery. They have support groups available every 3 months or so where they could meet patients who had similar procedures done in the past.
Okay, well, that's great that continued support is there. Now, let's talk about that free weight loss surgery seminar. It is Thursday, October 10, November 14, and December 12th. They all start at 6 p.m. at St. Joseph Medical Center in the Community Center of Building D. A light dinner is provided. Just call 816-943-6816 to register today. For more information, go to stjosephkc.com/ourservices/bariatric surgery. Thank you so much, Dr. Joseph.
Thank you, Belinda.
Bill?